Welcome, everybody. And we are working on our anatomical positions and terms. And what you'll need is your anatomy coloring book. And if you don't have the anatomy coloring book, that's totally fine. You will also just keep in mind that we do have a diagram for you on your Teachable, which we'll go over as well. So you can utilize the anatomy coloring book as a really cohesive tool to help you as you grow on your journey because we'll be referencing it quite a bit. In this module, we'll be using page 2 of the anatomy coloring book, and we'll be going over the terms of the anatomical positions and how they're referenced to, and just pretty much a very cohesive way to understand it so that we can speak this language to our students and allow them to really receive it and digest it and process it. So as we begin, we'll start in our teachables. So go ahead and pull that up. And also you'll see behind me, I've got my friend Skeleton here. So we'll go over Skeleton as well so that we can have some kind of cohesion with what we're talking about in respect. In your teachable, you should see the anatomical position and terms. And the first question that we ask is, what is anatomical correct or anatomical neutral? If we think about anatomical neutral, if you can see behind me, our anatomical neutral is a forward view. So we're looking at ourselves from the front or anterior perspective. The shoulders are open, hands are down by your sides, and the palms are facing forward. Why is that? What is the difference? Tadasana sometimes is taught with the palms facing forward or the palms facing inward. There's nothing wrong with it. The only difference is to speak that proper language of anatomical neutral, then we want to make sure that the palms are facing forward. And the reason for that is when the palms are facing forward, the ulna and the radius are parallel to one another, and they would be parallel to one another on either side. Here, our skeleton shows us that when the palm is turned inwardly, that the ulna and the radius are no longer parallel to one another, but in fact, they look like they're almost crossing each other here. What is also very interesting is that when we get into downward facing dog, we will notice that the ulna can move, the ulna and radius can move on their own and away from our tricep muscles. So we are from the humerus bone, tricep muscle. So we can really notice the difference here when we're opening the jam jar and we're closing the jam jar. Okay, so in Tadasana, we want the palm to face forward so that the ulna and the radius are parallel to one another on both planes of symmetry. And that's another thing that anatomical neutral means, that it's for the most part symmetrical. We do know that we have students that have maybe one shoulder higher than the other or one hip higher than the other, which is natural, but we want to keep in mind that anatomical neutral traditionally is just parallel to one another on either side symmetrically. Palms facing forward. Palms facing inward would then take away from it being anatomical. And we scroll down over to some key terms to get comfortable with. I don't expect you to memorize them, so please don't feel like you have to memorize all of them, but be familiar with them. And the reason for that is if you're taking this into more of the medical route, or if you're taking this training and wanting to deepen it more anatomically, then you would like to have a cohesive language. And in the anatomy world, we utilize these specific terms. And so the first term is superior. Here, if you're following along, or if you're listening, then you'll notice on your on E 4.2 major bones under anatomical positions and terms, you'll see the key terms there, and we're beginning with superior and inferior. Superior, or the prefix sup, is higher towards the sky. And so when we are speaking about it being higher towards the sky in anatomical language, we would reference that the skull is superior to the chest cavity. when we're utilizing the inferior or the inf prefix there, the inferior just simply means that it's closer towards the earth. The pelvis is inferior towards the earth. The pelvis is inferior from the skull. So it's closer to the earth and beneath the skull. Next will be anterior and posterior. Anterior, this prefix means anything that's in front of us. Anatomical neutral, front of us, open. Anterior pelvic tilt. So this skeleton on the second side is turned on the side plane. The chest cavity, the face, front of the pelvis, down the femur, the tibia, the patella are all, including the meninges and the phalanges of the feet or the metatarsals of the feet, are all anterior to the front of. Anterior. The back side, coccyx vertebra, the back of the skull, down into, again, the femur. This time we're looking at the fibula, and I'm sorry, the fibula, excuse me. And then the Achilles tendon, we're going around into the heel and again down to the bottom of the foot. The heel portion, along with the back portion of the body, would be known as the posterior. So we have the anterior, anticipation, anticipating something is about to happen, right? We're coming into something. So the anterior, and then the posterior, the post game. What happened afterward? The back part of it. The antagonist, the protagonist, anterior, posterior. So kind of playing with word association might help a little bit too. I like to always kind of throw something in there for that. Lateral and medial will be our next one. And when we go into lateral and medial, lateral means further away. And it's going to be further away from the midline. And so here we're seeing that for example, let's say here's the sternum right in the center of the chest. And we can say that the humerus is lateral to the sternum. And when we want to say that something is closer to the midline, that would be medial. Then we would say the ribs are medial to the sternum. Medial is closer to, and lateral is further away from. The skull is lateral from the pelvic floor. It's further away from the pelvic floor. But if something is centered, the skull is medial to the sternum. So it's in the same plane. It's in the center line. So it's towards the center, closer to the midline of the body. Now we're moving into superficial and deep. This one could be a little bit trickier to explain, granted, because it almost sounds as though I'm kind of making it up, but I'm not, trust me. And we're going to refer to the anatomy coloring book as well for the reference here. Now, superficial is close to the surface. So if we think of something being close to the surface, we can think of our myofascial system. So with the myofascial system, it's closer to the epidermis layer. It's right underneath. We can say that our skin is superficial to our muscles. Our skin is superficial to our bones because our skin covers our bones. So this would be a representation of superficial. It's above. The rib cage is superficial to the heart. The rib cage is the protector of the heart, so it would be superficial to it. And then the terminology of deep would represent like the position of the intestines or the heart. The heart is deep the heart is deep in location to the rib cage because it's underneath or beneath. So the term deep could be utilized as beneath, below the superficial layer. In our anatomy book, it is broken down as superficial is synonymous with an external, and the term deep is synonymous with internal. So anything that's on the outside, and this is a really great reference to anamaya kosha, the outer layer, and then anything that's deep on the inside, it's a little bit more introspective. So we would probably want to focus more on that manamaya kosha, that intellect body, that wisdom body, that internal introspective self. So thinking about it maybe in those terms as well might be helpful. So again, superficial is closer to the surface on the external side of things, while the deep is more internal. The heart is internal and the skin is external. And then we have proximal and distal. So proximal is closer to the attachment of the appendage. And if we look at our skeleton friend again, on both views, we will see that the attachment of the shoulder socket here, it has a ball and joint, right? This would be proximal because its closest point is within the attachment. Okay. Now, this attachment is not attached down here. So this would be distal. So the ulna is distal to the femur. So it felt like that would be helpful, at least a little bit, right? Giving us some options to understand a little bit better. Now, distal means far away. So it's far away from the attachment. The ulna is far away from the attachment of the shoulder girdle. And then we come to ipsilateral and contralateral, excuse me. And ipsi means it's on the same side. So my left eye is ipsilateral to my left cheek. Now, contralateral means it's on the opposite side. So my left eye is contralateral to my right cheek. So it just means the opposite side. So this would be a quick reference point for you to go back and reflect on. And below, I'll be inserting here another diagram of our skeletal system so that you can get a better understanding, and it will be labeled as well so that you can see the anatomical positions and the terms in more of a visual aspect. But I also really encourage you to go into page 2 of your anatomy coloring book, read through the notes. They're pretty much the same that we have here. And then I would like for you to go back through and do your coloring and associate that into your memory cycle so that you can have a better understanding of how this is working in relation. So let me stop the share here. So let's go back. So if you can see that a little bit better here, we have the diagram, and then next to it, we have all of the terms. You then go ahead and colorize whichever the term is in association to where you see it on the diagram. Okay. And there'll be a little cheat sheet for everyone as well, but it's really important that you just familiarize yourself with the terminology. It really helps you in the long run when we start to move this into more traditional and more integration with our medical practitioners. Namaste, y'all, and I'll see you in the next video.